On this Sunday night, COVID-19 defiance.
These police or anybody else out here is not going to tell us that we can't go to church.
Those breaking the rules and the reality check from inside Canada's hospitals.
COVID wards are expanding. They're very full.
Fauci's frightening warning to the US.
We may see a surge upon a surge.
As millions head back home this Thanksgiving weekend. Plus, the COVID-19 economy.
This isn't about how much money are you spending. This is, what are you stabilizing?
The federal government's long-awaited look at the books and helping the homeless. The added challenge during this pandemic.
Global National with Robin Gill. Reporting tonight, Sonia Diol.
Good evening. Thanks very much for joining us. The number of COVID-19 cases is still rising rapidly across Canada. So too are the acts of defiance against pandemic restrictions. Public health orders are in place to try and keep our hospitals from being completely overwhelmed. Many already treating record numbers of COVID-19 patients, and intensive care units are being pushed to their limits. But in places like Calgary and Steinbach, Manitoba this weekend, there was a complete disregard for health measures. The Yourex-West looks at the pandemic pushback in our top story tonight.
Churchgoers at Steinbach, Manitoba's Church of God were defiant Sunday morning, lining the highway to take in a service over loudspeaker as RCMP blocked the parking lot. Under Manitoba public health order, even drive-in services are not allowed.
I believe in God, and I believe in our Constitution, and I believe in our Bill of Rights in Canada.
It's true that Canadians have a right to things like religious freedom, but during a public health emergency, those rights can be restricted if health officials feel measures are necessary to curb the spread of COVID-19.
In places where healthcare resources are so strained, like Steinbach in Manitoba, you really have to have public buy-in, obviously. You really do have to have people that are following and adhering to the guidance.
A rally in Calgary Saturday saw several hundred people gather in protest of provincial restrictions as well, even as Alberta doctors worry that measures announced earlier in the week don't go far enough. An Edmonton ICU physician says he sympathizes with protesters.
I understand it. I had to go out into the real world for an errand. I haven't done it forever. And the relief of just pretending it wasn't there was incredible.
Pretending, though, doesn't change reality and the very real human cost of ignoring the serious situation at hand. On Twitter Saturday, Dr. Markland shared in gut-wrenching detail the heartbreaking moment he had with a sick COVID patient just before she was put on a ventilator. He writes, "She catches me in a pause. Now her tears come in hot streams. She clasps her phone in her hand and lifts it up. Yes, you should call your son and husband. Just in case. More tears now, but now we are both crying."
The slow, inevitable progression of this disease allows us a little time to actually really be exposed to the humanity of this, and that's hard.
Made more difficult by the knowledge of what's to come. Thousands of daily new infections will mean hundreds more will need hospital care in a few weeks' time, filling up beds that are quickly running in short supply. Heather Yourex-West, Global News, Calgary.
Well, let's show you the bigger picture of COVID-19 cases across the country today. Of the provinces and territories reporting new case numbers, Ontario had the highest number with more than 1,700 new infections. Quebec has had nearly 1,400. Manitoba recorded 365 new cases, a similar number in Saskatchewan with 351. There were a total 28 new cases in the Atlantic provinces today. None of it had 13. The other territories in BC not reporting any numbers today, but Alberta had more than 1,600 cases today, following a record-breaking day yesterday. As a result, Alberta now has the second highest rate of active cases in the country, 341 per 100,000 people. Manitoba still has the highest rate with 659 active cases per 100,000 people. Tomorrow, the Finance Minister will deliver a much-anticipated economic update on its pandemic finances. It is unclear exactly whether or not this is going to look like a full budget, but it is expected to chart a course for the months ahead. Michael Couture has more for us from Ottawa.
After months of demanding a full accounting of Liberal spending, Conservative leader Aaron O'Toole is seemingly shifting his focus.
My top priority is a plan for vaccines. There is no plan for the economy if we don't have rapid testing and vaccines as swiftly as possible.
The pandemic will likely be the central theme of the economic update, and while the Conservatives have supported the bulk of federal relief measures, O'Toole is hoping for some restraint from the finance minister.
So I want to see if she remains in that same view that she can spend without regard to the public finances as long as interest rates are low. I'm hoping that's not her fiscal anchor.
Prime Minister Justin Trudeau warned last month not to expect a fiscal anchor, and some economists believe Freeland's update won't be a complete roadmap of where the country is going because so much is unknown.
Some kind of marriage of the scenarios that we are starting to hear about consistently from a public health perspective, that will color the financial outlook.
The economic statement will likely mirror some of the themes of September's throne speech, which focused on getting more women back into the workforce and growing a green economy, among other things.
Are there going to be new investments in long-term care, in healthcare? Are there going to be new investments in childcare? Some areas that really were highlighted by this pandemic, but I think that are of interest to the Liberals in the long run.
That extra spending is expected to raise the deficit, which stood at $343 billion in July, the last time the government provided a fiscal snapshot.
Look, we don't have any options other than spending right now. We've gone through the looking glass. This isn't about how much money are you spending. This is what are you stabilizing? And if you don't do it, what are you making worse?
Plenty of hard-hit industries will be looking to this update for help, including the airlines, which have been decimated by the pandemic as travel essentially came to a halt. Sonia?
Michael Couture in Ottawa, thank you very much for that. Well, in the US, today is the busiest travel day of the year as millions of Americans head home from Thanksgiving celebrations. With so many ignoring the warning not to travel, health officials are bracing themselves for another deadly surge. Jennifer Johnson has more on the crisis ahead.
As millions of Americans return home through airports and on the roads after the Thanksgiving holiday, the busiest travel day of the year, healthcare experts warn there will be consequences.
Clearly in the next few weeks, perhaps even 2 or 3 weeks down the line, we may see a surge upon a surge. You know, we don't want to frighten people, but that's just the reality.
An estimated 7 million people traveled through U.S. airports from November 22nd to the 25th ahead of the holiday. Now they are heading back home with this advice.
If you're young and you gathered, you need to be tested about 5 to 10 days later, but you need to assume that you're infected.
Healthcare officials fear what's coming. One doctor offering this warning.
I hope that the last moments of your life don't look like this, because this is what you'll see at the end of your life if we don't start wearing masks.
Los Angeles County officials are not backing down as their controversial 3-week ban on public and private gatherings takes effect Monday.
Dead people don't get a second chance.
Doctors are frustrated so many Americans are ignoring safety guidelines, like this massive illegal party busted in New York City, as the release of a vaccine gets closer. On Saturday, the first doses of a vaccine were flown from Brussels to Chicago, awaiting federal approval. For those on the front lines, it can't come soon enough.
It's been really tough for us. Resources have been stretched thin. The staff has been stretched thin.
The White House Coronavirus Task Force is hoping to meet with President-elect Joe Biden's administration Monday, while federal health officials vote Tuesday on who will get the vaccine first. But it will be up to each state to make the final decision. The overwhelming recommendation is for healthcare workers to get the vaccine first, as many hospitals are overwhelmed with COVID-19 patients. Jennifer Johnson, Global News, Washington.
Well, Black Friday shopping is always a part of Thanksgiving celebrations in the US, and many Canadians would usually head south of the border to grab some deals. Not been the case this year, with the borders still closed to all non-essential travel. But as Tim Sargent now explains, work is underway to figure out how to reopen safely.
As thousands of Montrealers hit downtown in search of Black Friday deals, some bargain hunters may have preferred doing their holiday shopping south of the border. But the ongoing closure is forcing people to stay in their respective countries.
Let's try to, see what it is that we are going to change.
But now, former Quebec Premier Jean Charest is part of a joint task force with other former lawmakers, looking into the conditions under which the border can eventually reopen. The task force he's part of needs to make recommendations by March.
Does it mean we'll have to have a vaccine? Does it mean we'll have to produce a health certificate? Will we have to have our temperature taken? I mean, there's a whole host of issues, of questions.
That's a question that a lot of people who live near the border are asking. Robin Smith is a dual citizen who just moved into Canada to be close to her parents. She lives in a community where the border separates the town of Stansted, Quebec, and Derby Line, Vermont. Smith is in no rush for the borders to reopen to non-essential travel.
My family members, people I know here, they don't really want it to open either.
The land border between Canada and the U.S. has remained closed to non-essential travel since March. Last week, the number of non-commercial vehicles entering Canada was down 92% compared to the same period last year. But commercial traffic, a different story. Almost 118,000 trucks entered Canada last week, a drop of only 1.8% compared to 2019. Trucker Sean Lemaire favors some sort of health check before allowing people to cross the border.
As partners, Canada and the U.S., I don't think we're anywhere near ready.
Unless the infection rates drop dramatically and quickly, then the borders will likely remain closed through the holidays. And the hundreds of thousands of people who normally cross on a weekly basis will likely have to wait until well into 2021 to visit each other's country. Tim Sargent, Global News, Montreal.
There could soon be an end to the lobster fishery dispute in Nova Scotia. The chief of the Sabaganagadi First Nation says he's reviewing a draft agreement from the federal government. It would allow the Mi'kmaq community to legally harvest and sell their catch. The deal also has the potential to be a historic recognition of treaty rights and bring understanding to the term moderate livelihood fishery.
All we want to do is exercise our right and to have our communities out of poverty, and I think this will help bring our people's standard of living upwards, and that's what I mean for us. People don't realize what we're really doing it for, and it's just a better way of life for our people.
Sabaganagadi fishers launched a moderate livelihood fishery back in September. Since then, several Mi'kmaq First Nations have followed suit. Many non-Indigenous fishers have been critical of the move. The dispute sparked violence over the last 2 months. Sabaganagadi could be the first Mi'kmaq band to reach a deal with Ottawa. Still ahead, the lucky escape nothing short of a miracle after a Formula One driver is left trapped in a burning car.
And a big fire there as they exited out of turn 3, and that looks very nasty indeed.
Well, he's lucky to walk away. F1 driver Romain Grosjean hit the wall at full speed during the opening lap of Bahrain's Grand Prix. The force cutting his car in half and wedging him between the wreck and the barrier. Miraculously, he escaped with only minor burns to his hands and ankles. Reigning champion Lewis Hamilton, who went on to win, said the risk drivers take is no joke, and the good outcome is a credit to how safety standards have improved. Saskatchewan's health authority has declared a COVID-19 outbreak among a teenage hockey team. 9 players and 1 coach on the Warman Wildcats have tested positive. As a result, the entire team, along with their most recent opponents, are now having to self-isolate. As of Friday, team and group sports in the province were suspended. Athletes under the age of 18 can still practice in small groups, but those taking part have to stay at least 3 meters away from each other and wear a mask. A big question tonight about how much longer the NFL season is set to last, as more teams are being hit hard by COVID-19 and players are having to sideline to quarantine. The Denver Broncos are facing New Orleans Saints without any quarterbacks after 3 Broncos players were identified as high-risk close contacts. In a statement addressed to all teams, the NFL commissioner confirmed that a number of staff and players celebrated the Thanksgiving holiday with out-of-town guests. All team facilities are being ordered to close for the next 2 days to slow the spread of the virus. A woman's made history in Power 5 football. It's the highest level of college football in the U.S.
And Sarah Fuller. Happy Thanksgiving. What a day.
Sarah Fuller ran out for Vanderbilt University yesterday, becoming the first woman to play in the competition. Fuller kicked off to start the second half against Missouri. The 21-year-old soccer player from Texas was actually called in after Vanderbilt lost a number of players due to COVID-19 restrictions. The best part, that she wore the phrase "play like a girl" on her helmet. Still ahead, the struggle of grappling both health and homelessness during this pandemic, and those stepping in to help.
You're watching Global National.
Welcome back. Well, the pandemic has had an impact on all Canadians, but it's hit those on a low income especially hard. There's now a growing concern that the number of homeless people in Canada may go up. It's estimated at least 235,000 Canadians experience homelessness in a year. 35,000 experience homelessness on any given night. Global's Catherine Ward now has the story of a man from Toronto who is struggling to get the help he needs.
If I didn't go to the hospital, I would have been dead.
That emergency was the wake-up call Jimmy Evans never expected. Jimmy had been in and out of the shelter system for years since arriving in Toronto from Prince Edward Island. Things were starting to get better. He managed to secure affordable housing. But on that day in 2017, years of hard living made it clear Jimmy was very sick. Jimmy was suffering from end-stage liver disease. Doctors told him they didn't know how long he would live.
They said 1 year to 2 years. 2 doctors came in. And then they said, "Do you realize in the past 5 months you had 2 heart attacks?"
According to the City of Toronto, Jimmy is one of more than 8,000 people who fall on the homeless spectrum. For the last 2 years, his care has fallen through the cracks as he missed appointments, and doctors sometimes had a hard time finding him for follow-ups. This past summer, Jimmy was referred to the Palliative Education and Care for the Homeless, or PEACH program. Started in 2014, the program is one of only a handful in Canada that works with people on the homeless spectrum who are in need of end-of-life care. Dr. Dasani is one of the physicians. He says since the pandemic, the PEACH program is seeing double the number of patients.
What COVID has kind of done is made the safety net that supported people from moving towards more homelessness even weaker. Because of that, we are seeing more people who are experiencing street homelessness. We're seeing more people who are losing their housing.
COVID-19 has created new challenges.
People who are living on the streets and experiencing homelessness previously had supports in, say, drop-ins or respites or various shelters, and many of these places are now closed.
Since the start of the pandemic, many doctors have moved to virtual consults. The practice adds an additional barrier for these patients.
If you get a new diagnosis of cancer and you're living in the shelter system and trying to coordinate access to something like a specialist appointment when all the specialists are using phones for their visits, if you don't have a phone, then how are you supposed to get to those visits?
The PEACH team helps fill in those gaps. Leanne Trevors works as the group's health navigator. She arranges transportation for checkups, renews prescriptions, and coordinates meals, solving whatever patient problems arise.
We never want to push to say this is what you need. We'd rather ask them, what do you need and how can we support you?
Since joining the PEACH program in the summer, Jimmy has not missed a single appointment. Now he has new dreams of going back home to PEI to see the ocean one more time.
Go deep sea fishing where you can't see land and jump off the boat and go for a swim. The future is going to be what it is.
Catherine Ward, Global News, Toronto.
Up next, Montreal's new approach for providing winter warmth to those struggling to find it.
Maybe more. I did.
Well, December is just days away and the weather is getting colder. For Canada's homeless population, it makes an already difficult life even more challenging, especially when cities don't always see eye to eye on the methods on how to keep the homeless warm, such as setting up camps in parks. But as Mike Armstrong explains, Montreal is taking a new approach on how to get people off the streets.
This camp popped up over the summer. Wedged along the side of a busy boulevard, thousands pass it morning, noon, and night. The people in it say that's why the city wants them out.
They want us to disappear. Homelessness is showing up in Montreal, and they don't like it to be showing.
At its peak, the camp was home to about 125 people. That's dropped week by week. There are only a couple of dozen left. The city has an outreach program explaining to the campers there are options.
If they don't want to stay here the entire winter, then we offer them to come to the shelter.
One thing being offered this week is storage. The city's promising to pack up possessions and give them back to people in the spring. There are also 700 new beds being made available. This downtown hotel is being turned into a shelter. And there's a new city bus that's going to be making the rounds, offering a chance to warm up and another chance at outreach.
That's what it's all about, to make sure that they know that we're there to support.
The city's also trying something new. It's pairing a police officer with a social worker, creating a team dedicated to the homeless population. Right now, even the people pushing it say it's likely not enough, but it's a start.
I think it's probably the future of policing is being tried right here this winter, and that's a good thing.
The challenge continues to be getting people off the streets if they want to stay.
That can isolate.
Over the months, some have been preparing for winter. This man gives his name as Jacques and insists he's ready.
Who are they to think what I need? I know what I need. I don't need nothing except peace, respect, and liberty.
The problem is that Jacques has a nice place and then a heater and all that, but the guy besides him do not, but he's following Jacques.
Now, the goal is to get as many people out of this camp as possible before the temperature drops to -30 and -40 in the coming months. Basically, before it's too late and lives are in danger. Mike Armstrong, Global News, Montreal.
And that is Global National for this Sunday. I'm Sonia Diol. We leave you tonight with a friendly blue dragon that's been lazing around in the Saskatoon snow. The woman behind this incredible snow sculpture usually makes one on her driveway every winter, but decided to go extra big to make her neighbours happy this year. Donna Freeland is back at the anchor desk tomorrow. Thank you very much for watching. Have a great night.